This presentation is on in-home fall assessments. The objectives of this presentation are that you will be able to identify fall risks in the home, understand fall prevention strategies, identify patients at high risk for falls, assess patients for recent falls, and refer patients to hospitals if they have had a fall with serious injury. When you assess each of your patients during the home visit, there are many risk factors that you need to identify when determining a fall risk. They include lower body weakness, vitamin D deficiency. You will not know about vitamin D deficiency until the results of the lab test. Difficulties with walking and balance. Use of medications such as antihypertensives, sedatives, or antidepressants. Even some over-the-counter medications or medications that are easily accessible to the patient can affect balance and how steady one is on their feet. Vision problems, foot pain or poor footwear, home hazards or dangers such as broken or uneven steps, throw rugs, clutter that can be tripped over. These are some of the things that you should be looking for in the home during your home assessment. You want to know, is the furniture cluttering the environment? Are there any throw rugs on the floor? If they are, you may want to suggest double-sided tape or a non-slip backing so the rug doesn't move when the patient is ambulating. Keep objects off the floor. Keep wires and cords close to the wall and away from the patient's walkway. You want to determine if there are any loose or uneven steps and handrails and see if those can be repaired. Lighting. Is the patient able to see where he or she is going? High shelves. Be sure that the patient places things on shelves that are at waist length to avoid overreaching. These are some prevention strategies that you may educate your patient on or their family members if they're in the home. Encourage the patient to exercise regularly. Exercise increases strength and improves balance and coordination. Assess the patient's medication list. Determine if it is possible if the patient takes some medications that are more sedative during hours of sleep versus taking them during the day to prevent falls. Encourage shoes or non-slip socks and avoid slippers. Make a phone easily accessible in case the patient falls and needs to make a call. Encourage eye exams to determine patient visibility. What to do when a patient falls? First, you want to ask when the fall occurred, especially if the patient's mental status has changed. Ask about injury, especially if the patient hit their head. If the patient hit their head, they always must go to the hospital as soon as possible because you never know if there's an intracranial bleed going on and that's unable to be determined. Assess mental status. Refer to hospital if any emergent situation and notify the director. If the patient is on any anticoagulants, the patient is at increased risk for internal bleeding. This actually happened to my grandmother. She fell and nobody took her to the hospital. She began vomiting a lot for several days and no one knew why. And finally she had a head scan done and they found out that she was bleeding internally in her head. And she then reported that she had a fall some days prior to that. That's why I say it's so important when anybody falls that they need to go to the hospital to get imaging done to prevent death because it can become a very serious and sentinel event. And we don't want that to happen. We are in the caring and living business. We want everybody to care and live. We are trying to prevent death and mortality. So it's important when anybody falls that they get checked out no matter how small you think the fall is. If they're having pain in any of their joints, or any of their parts of their body, they need to get that specific area checked out. If they fall and hit their head, that is always 10 times out of 10, they need to go get imaging done.